thank you very much for joining us this evening, this morning, this afternoon, wherever you're joining us from. This is the Schumacher Nutrition Incentive Program Produce Prescription Program RFA webinar. Please feel free to go ahead and introduce yourself, your organization, where you're from in the chat. We will be taking questions via the chat at the end of the presentation. We're gonna go through the programmatic requirements, some administrative requirements, and then of course all of the wonderful technical assistance reporting and evaluation resources available through the GusNIP NTAE and Nutrition Incentive Hub. Of course, as we get started, we do want to make sure that everyone is aware of USDA's Non-Discrimination Statement and the resources available. So please, if there is any opportunity for us at NIFA and of course, right, our sister agencies across USDA to make our programs more accessible, we urge you to reach out, make us aware of that. We want to be responsive to that and make those changes as soon as possible. Next slide, please. I like to begin with this slide so that you're all aware of the wonderful team that we have both at the National Institute of Food and Agriculture and at the Food and Nutrition Service that works with the GusNIP program. I'm going to highlight a few of the colleagues who are online with us today. If I haven't had the opportunity to connect with you yet, face-to-face or screen-to-screen, my name is Mallory Koenigs. I am a national program leader at NIFA, and I provide leadership to the GusNIP Produce Prescription Program. I'm joined this evening by Mr. Ryan Cornegay. Ryan, would you like to introduce yourself?
Good evening, afternoon, or morning to everyone. So excited to have you all on to share with us for the Produce Prescription RFA webinar. And I'm excited to share more about the program with you.
And Summer LaRose.
Hello, everyone. I'm Summer LaRose, a program specialist with GusNIP, and I'm happy to be here and meet everyone.
Beth Curling.
Hello, welcome everyone. I'm in the awards management division here at NIFA, and I help support the GusNIP program. Happy to be here.
Sierra Casitas.
Hi, everybody. My name is Sierra. I'm a program specialist for this program along with Ryan and Summer, and it's nice to meet all of you.
And we are also joined by our co-presenters from the Nutrition Incentive Hub. We have Rachel Ho.
Hi, everybody. My name is Rachel Ho. I'm the acting director of the Nutrition Incentive Hub here at Fair Food Network, and we're based in Michigan. I'll talk to you later. It's nice to see all of you.
And Dina Nugent.
Hi, my name is Dina Nugent. I'm a research scientist with the Gretchen Swanson Center for Nutrition, which is responsible for leading the evaluation of all GusNIP projects. So I will be talking to you about reporting and evaluation today. Great to see you all.
Thank you very much. Next slide, please. We want to begin with some key programmatic changes in the 2022 RFA. The first is that new in 2022, the GusNIP Produce Prescription Request for Applications is now separate from the Nutrition Incentive Program Request for Applications. Also, there is a new requirement to complete a 1-hour consultation with the Nutrition Incentive Hub, which is the group of collaborators and partners that is formed by the Nutrition Incentive Program Training Technical Assistance Evaluation and Information Center, or NTAE, or GusNIP NTAE for short. This is the awardee that specializes in technical assistance, support, resources for evaluation to provide to any potential applicants as well as awardees. And this required consultation is completely free of charge and is a resource to all interested applicants to avoid general pitfalls. Also, as documentation of completing that consultation, there does need to be included a letter of support in the grant application. And also in the 2022 RFA, previous funding allocation guidance has been removed. Next slide, please. We also want to make sure we're highlighting for everyone the emphasis and the priority being placed on proposals that serve underrepresented communities and underrepresented geographies. Next, please. Some key resources are shown here. Of course, where the request for applications can be found, where the frequently asked questions documents can be found, and those core metrics resources. Many of these we'll go through this evening. And of course, I would be remiss if I didn't mention that the due date for proposals is June 30th at 5 p.m. Eastern. Next slide, please. I'm now going to invite Mr. Ryan Cornegay to present the Produce Prescription Program information section.
Thank you, Dr. Kanan. So as we go through the Produce Prescription Program, I want to start off sharing some of the purpose of the program. And as you will see, as Dr. Kanan has talked about it a little bit, is that you'll be able to see the page numbers that are associated with the specific information that we're presenting here. So specifically here for the Produce Prescription Program, the RFA pages directed to the purpose will be on pages 7 through 8 of the RFA. So the purpose of the Produce Prescription Program is to bring stakeholders together from distinct parts of the food and healthcare systems to foster an understanding of how they might improve the health and nutrition status of participating households, prescribe fresh fruits and vegetables. The purpose is also to demonstrate and evaluate the impact of the project on one area of the improvement of dietary health through increased consumption of fruits and vegetables, the reduction of individual and household food insecurity, and the reduction in healthcare use and associated costs. And as we talk about fruits and vegetables, specifically for the GusNIP program, that's looking at any variety of fresh, whole, or cut fruits and vegetables. So for eligibility of the Produce Prescription Program, nonprofit organizations are eligible applicants for this program, as well as government agencies are other eligible applicants for this program. Institutions of higher education that are either local, county, tribal, territory, or state government agencies must provide documentation in support of eligibility as a government agency. And Veterans Health Administrations and various components of its healthcare system such as hospitals or clinics, are eligible government agencies as well. So as we talk about the required healthcare partner for the produce prescription program, as defined on page 13 of the RFA, the required healthcare partner may include either a hospital or a federally qualified health center, a hospital or clinic that's operated by the Secretary of Veterans Affairs, or a healthcare provider group. Applicants must include a statement that specifies the eligibility of the healthcare partner or partners under one of four of the categories that share here. We're encouraging applicants to seek and create partnerships with public or private, nonprofit or for-profit entities that include links with academic institutions that may also engage minority serving colleges or universities and or other appropriate professionals, community-based organizations, tribal nations, local government entities, tribal health centers, public health departments, pharmacies, school nurses, private or public health insurance agencies, and our partnering entities for the purposes of providing additional resources and strengthening the historical failure in underserved communities. So even though nonprofits and government agencies are only eligible to apply for the program, we very much encourage and welcome you to partner with any of these sorts of entities that will help make your program be even more comprehensive. So for the program area description for the program area code for the produce prescription program is PPR, as you'll see referenced here a few times. The proposed budget request is up to $500,000 for up to 3 years for your projects. Produce prescription projects, standard projects, support the development and evaluation of tribal, county, district, multi-county, territory, or statewide projects that prescribe fresh fruits and vegetables to eligible individuals. The proposal may also provide financial or non-financial incentives for eligible individuals to purchase or procure fresh fruits and vegetables. It may also provide educational resources on nutrition to eligible individuals as well, or it may establish additional accessible locations for eligible individuals to procure fresh fruits and vegetables. So as we talked about these eligible individuals, who are they? What does that mean? Individuals are eligible to participate in a PPR or produce prescription project if they are a member of a low-income household that suffers from or is at risk of developing a diet-related health condition, and one of the following: eligible for benefits under the Food and Nutrition Act of 2008, specifically the SNAP program, if they're eligible for that, or if they're enrolled in a medical assistance under a state plan or a waiver, such as a plan under Title 19 of the Social Security Act, as shared here, and that is specifically Medicare as well. Medicaid as well. And I will, with that, I'm going to turn it over to our National Program Leader, Dr. Canis, to take us through the GusNIP Comprehensive Evaluation.
Yes, thank you so much. We want to make sure that all potential applicants are aware that the GusNIP program has a nationwide evaluation that all funded projects participate in. So all produce prescription awardees are required to collect that core minimum data set, to collaborate with the GusNIP NTAE in collecting those data, and of course, sharing those de-identified data with the NTAE, as it is their role to aggregate that national sample. Now, of course, this establishes a foundation, and individual applicants are welcome, to really build on that core minimum data set with additional, outcomes of interest that would make a contribution to the program as a whole. Next slide, please. We also want to make sure that everyone is aware that the form and the formatting that all of the documentation needs to be in when it's being submitted in grants.gov is the portable document format or PDF format. Grants.gov may accept other file formats. However, right, NIFA systems do not. So please please plan to double check that all of the documentation is in PDF form when submitting. Next slide, please. I want to make sure that we step everyone through the application components. The first being that project narrative. The project narrative needs to be, a document with 1-inch margins that's 1.5 space and written in 12 points times New Roman font. The page limit that cannot be exceeded is 15 pages, and that's 15 pages for all written text, figures, and tables. And the share of those 15 pages that can all be distributed by project teams, right, as what best fits your proposal. However, that 15 pages is a firm limit, right, to ensure fairness for all applicants. There is one case where an additional page may be included, and that's if a proposal has been previously reviewed by the Produce Prescription Program and it's being revised and resubmitted. There can be one additional page that contains the response to that previous peer review. This application contents also include the logic model, business plan, data management plan, and letters of support. And all of those page limits are shown here. We'll go into more detail about the required letters of support from a healthcare partner, right, in one of the 4 categories that Mr. Cornegay talked about, as well as that letter from the GusNIP NTAE Center documenting completion of the consultation. Next slide, please. All right, so within that 15-page project narrative, what content needs to be covered? What I'm showing here are the 8 headings, right, that we recommend your project narrative include to, guide the peer reviewers through the proposal. And you'll see, right, introduction to the communities involved in the project that will benefit from the project, what personnel and resources from the organizations and the communities are involved, the goals, intended outcomes, the specific activities, the relationship, right, of those goals and activities to the produce prescription program, right, programmatic level goals and priorities, that evaluation component that we talked about, where, right, at that foundation needs to include those core participant level and firm level metrics, which our NTAE colleagues will go into more detail on in their time. Sustainability, and then non-supplantation. So, really making it clear that with produce prescription, grant program funding, there are additional, right, new or expanded activities that are going to be completed, rather than just replacing one source of funding in an already active and established project with another. Next slide, please. What we're showing here are the multiple different roles that the required healthcare partner might have in a project. Of course, right, a healthcare partner in one of those 4 categories needs to be involved in the project. And that letter of support should include, their role. And it could be, right, a subset of the activities shown here, or it could be all of them. But it is important that in that letter, that information be conveyed. Next slide, please. I'm not going to go into more detail about the actual letter from the NTAE, because Rachel will be covering that in depth in her section. But suffice it to say, we want to be sure that everyone is aware that that letter does need to be included and uploaded in the grant application. Next. Okay, we're going to provide an overview of what the reporting and evaluation expectations for a produce prescription award will look like. Next. And this includes, the expectations for all awards from the National Institute of Food and Agriculture. So that's where the report system, which we spell REEPORT for research, education, and extension. This is where project initiation reports, annual progress reports, and final technical reports are submitted. There's also annual financial reports submitted there. And then what we call the standard form 425 or federal financial report that gets submitted annually to the awards management division at the awards mailbox shown there. And for the produce prescription program in particular, there is also that expectation, for collecting the core data set, participant level and firm level, sharing those data with the GusNIP NTAE so that they can be aggregated on that national scale to improve all of our knowledge and also disseminate best practices. Next slide. And again, really reinforcing what the expectations are of that comprehensive program evaluation. This, as you all can tell, is a duplicate slide here to reinforce that. Next section, please. All right, how are proposals evaluated? What is NIFA's peer review process? Next. We do conduct an initial administrative screening, to ensure that all files are in PDF format, that all of the page limitations have been respected, that maximum, budget request of $500,000 of federal funds, is not being exceeded, and that those two essential letters, the letter of support from the healthcare partner and that letter from the NTAE, documenting completion of the consultation are in the grant application. And once that screening is complete, then proposals move to the peer review process that I'll go through on the next slide. And any organizations that have received grants from USDA and NIFA in the past will also be looked at for history of compliance with previous grant requirements. And next, looking at that peer review process, there will be 3 reviewers assigned to each proposal, and using the evaluation criteria published in the RFA, which will be shown here in a moment, they will provide their individual assessment, of the strengths and weaknesses of the proposal using those criteria. Those individual reviews then begin that discussion of the full peer review panel. And then that discussion, is where consensus of the peer review panel is formed, and the final ranking and rating of proposals is determined. And some of you who have applied to grant programs in the past may also be familiar that that discussion is documented in the form of a panel summary. And for all applicants, the reviews and reviewer feedback are provided to you after review is complete. Next slide. Here are those evaluation criteria. And again, the exact evaluation criteria published in the RFA is what is provided to the peer review panel for them to complete their assessment. Next slide. I share this timeline with everyone so that we're all aware that after the proposal due date, right, after June 30th, it does typically take from 3 to 5 months to complete that, right, peer review process and award process. So please do not be surprised if if it does take about 3 to 5 months before you hear from NIFA. And the next speaker is going to be Beth Curling.
Thanks, Dr. Canings, and thanks, Ryan, for driving the slide deck tonight. I am with the Awards Management Division, if you're a few minutes late and missed our introductions, and my role really comes into play after that peer review process and as those recommended awardees start to move towards a new award and then throughout the life cycle of their award. And so I want to share with you a little bit of what that process looks like, as well as some helpful tips for making a budget that might make sense for your organization and then follows the rules and regulations of federal assistance awards. So in the RFA Part 5D, you'll find what's called organizational management information. And we explain in this part where that prior to award, you may be asked to verify or re-verify financial and internal controls. And that is something NIFA is required to do by federal regulation. Anytime you see a reference to 2 CFR 200 in this presentation, that is something that is freely available to anyone on a simple Google search, so you can read these policies in detail. But we might be asking for audited financial reports, detail of the cost accounting systems, policies on salary compensation. How in detail we get with these requests might depend on the size of your organization and if you participate in single audit, but we'll help work through that process with you one-on-one, again, for those proposals that are moving forward towards award. Next slide, please. The GusNIP program allows for full recovery of indirect cost rates. So if your organization has a negotiated rate, also known as a NICRA, you may apply that in your application. If you don't have a NICRA, there's still opportunity to obtain indirect costs. We know that those are real costs for your organization, and we want to support being able to keep your facilities and administration going. And so there is opportunity to participate in what we call the de minimis rate, which is a 10% modified total direct cost rate. Or you may also elect to waive indirect cost recovery altogether. And you might indicate that in your budget and your budget narrative that you are electing to waive indirect cost. We have a website, I've included it below. It'll help walk you through those options that are available to you and provide some more frequently asked questions in case this is a new area for you. Next slide, please. The next couple slides will be directed towards cost principles. And so these might be common costs that you want to consider putting into your application. So I want to provide a little bit more detail about each item, what might be allowed, what's not allowed, and then how you might describe that in your budget justification so that we clearly understand the need for your organization. So if you are considering salary and wages, we ask that you provide the annual or hourly rate of pay, time commitment, or the number of hours, percentage of effort that person is putting forth, and the tasks that person will be completing. We do request salary rates that are a normal rate of pay for that employee and in that job category. Participant incentives. We know that the Produce Prescription Program is perhaps incentivizing health by prescribing fruits and vegetables, but monetary incentives of cash or cash value are not allowable if they are intended to incentivize behavior. There are oftentimes in produce prescription programs surveys or evaluations or things that you would like your participants to engage with, and you might consider a participant stipend, something to reimburse their time and effort in those activities, but we are careful that we're not incentivizing behavior in those situations, and that is provided after that survey is complete. Next slide, please. If you are working away from your usual office space as part of this project and you need to rent something, that is an allowable direct cost. We ask that you provide an explanation of why you need to rent an office space, the monthly rental costs associated. If your organization owns that facility, then of course it would not be rent. We would ask that that become part of your indirect cost pool most typically. Some non-government organizations and nonprofit organizations may elect to establish their indirect cost pool slightly separately. We understand that as well. So if rent is not in your usual facilities and administration, please be clear in indicating that in your application. Also, rent must be prorated. So if you're sharing that space with another office mate or another program, we wouldn't expect that all of that space be dedicated in as a cost allocation to the GusNIP program. Next slide, please. Travel costs. We know sometimes you're going from town to town, especially in rural places. This could be quite a distance, or you might want to travel to a PD conference after your award is started to get with other GusNIP awardees in conversation. And so if you plan to travel, we'd like to know the purpose, the distant destination, number of trips, number of travelers, and the cost per trip. Materials and supplies are also a very normal cost to include in your budget. We just ask that you be as clear as you can in that explanation, in that budget justification. Tell us the estimated costs of items, the number you need, something to help us understand how reasonable is this request. Meeting space rental. This is slightly separate from rent. This would be if your organization needed to meet in a place that is other than your facility. Say, if it was at a church or an elementary school or a community center, you would want to ensure that if there's a usual cost, that would be included. But if it was in a place where the cost, I just want to pause for a second. Am I still with the can everyone still hear me?
Yep, we can. We lost the slide set for a minute.
Okay, I was just gonna roll with it.
You're good to go now.
Oh, thank you so much. Okay, and thank you, Ryan. I think we want to go forward. Perfect. Here we go. At the bottom of this slide was just indicating that if the facility does not normally charge for rent, the cost of that would not be an allowable cost. You can't just make up a cost to use a free facility, in other words. Okay, next slide, please. This is a snip picture of what your cumulative budget will look like once you get into grants.gov and download the forms that are required. Wonderful news in Produce Prescription Program for GusNIP, there is no match required. So you will be using the Fed-only budget. Please do include a separate justification, though. We read those very, very carefully, and it is common for us to come back and have some questions and engage in conversation. Don't be weary if you hear from us at that stage. We just want to make sure that we have a really solid understanding of what your needs are. And if there are costs that are unallowable, or we need to make small adjustments to the funding, sometimes we might have to cut budgets a small amount, or, in rare occasions, it can go the other way. We might make some of those adjustments on your behalf, or engage you also in conversation if it's a large cut, for example, greater than 10%. I think in the interest of time, I'm going to toss it right to my colleagues at the NTAE. Please keep the questions going in the chat, though. I know everyone at NIFA in particular will be happy to engage even while our colleagues are presenting here at the NTAE. Rachel?
Great. Thanks, Beth. Hi, everybody. My name is Rachel Ho. I'm the acting director here at the Nutrition Incentive Hub at Fair Food Network. And I'm going to start our presentation by giving you a quick overview of who the NTAE is, who the Nutrition Incentive Hub is, so you know a little bit more about who we are and the kind of services that we offer. So the Nutrition Incentive Hub, we're a coalition of partners, and we were created by the Nutrition Incentive Program Training Technical Assistance Evaluation Information Center, so the NTAE. You may hear Nutrition Incentive Hub and NTAE thrown around together. We're essentially the same thing. And our role is to support produce prescription and nutrition incentive projects across the country at any stage of their program. So we work with programs like yours that are considering applying for GusNIP grants. We provide technical assistance to programs that currently have GusNIP grants and programs in the field at large that may at one point be interested in applying for the grant. So we're really here to connect you with other programs across the country and resources. And we were created through the 2018 Farm Bill. Next slide, please. Great, so this slide here, this chart here on the right will be very useful to you. So the NTAE Center is led by the Gretchen Swanson Center for Nutrition, which is an evaluation nonprofit organization based in Omaha, Nebraska. And they also lead the reporting and evaluation arm of the Nutrition Incentive Hub. And Dina's going to tell you more about that in a few moments. My team at Fair Food Network, we lead the Technical Assistance and Innovation team. We're based in Michigan. And the gist of our work is that we are here to answer free of charge any questions you may have about program administration, running your GusNIP program. And I'm going to introduce you in the next few slides. So next slide. And we couldn't do this work without, oh, actually go back to the previous slide. I forgot about this. Anyway, we do this work with the help of our technical assistance partners. And as you can see here, we have technical assistance partners with expertise in areas like Farm Direct, which is farmers markets, community supported agriculture, farm stands, grocery retail, so grocery stores, corner stores, and that nature thing, produce prescription. So we have a specific team at the Michigan Farmers Market Association in DIESA and at the National Grocers Association Foundation that are our team that is specifically here to help you with your produce prescription program and questions. And we also have technical assistance expertise in diversity, equity, and inclusion, local sourcing, nutrition education, and corner stores in general. So all you need to know is that we at the Nutrition Incentive Hub, we are here to answer any and all of your questions about running a program, connecting you to other programs across the country, and really just making sure your program succeeds. So next slide. Great, so this is just a quick overview of the type of work that the Technical Assistance and Innovation team offers. We do one-on-one consultation support, like I'm going to tell you a little bit more about the RFA, growing the field through connecting you to other programs and leading many opportunities for you to get to know other practitioners in the field. Next slide. Great, so what might be interesting to all of you is one of the big areas of technical assistance that we offer is one-on-one RFA support. So the best way to engage with us in general is to email us at ta@nutritionincentiveHub.org. On a higher level, the type of RFA, GusNIP RFA support that we offer with our team at DIESA, we can help you with your project planning and ideation around your GusNIP application. You can ask us very specific questions about the RFA, sort of interpretation. What does this line mean? Can you help us explain what these different parts of the application mean? We're here to help you with that. And we also offer high-level application review. So once you have more written down, more of the narrative section, we're happy to do higher level overviews of that and give you some suggestions for your application. Next slide, please. Wonderful. All right, so as Mallory mentioned before, the consultation session of the NTAE it's now a requirement of the GusNIP application, both the nutrition incentives and the PPR. So what that means is that you need to have a consultation of approximately 1 hour with the NTAE Center, the Nutrition Incentive Hub. And there's many ways that you can meet this 1 hour. The first is that you can email us at ta@nutritionincentiveHub.org and set up a one-on-one call with myself and one of my teammates, and we'll go into depth for an hour about your application. And you can engage with us for that consultation at any point in your process. You don't have to wait. It doesn't have to be at the very beginning. It doesn't have to be at the very end. Really, whenever you feel like you have an hour's worth of content to talk to us about. So first you can set up a one-on-one We also offer on a weekly basis on Fridays. I'm going to post a link with all this information when I'm done. Every Friday, we offer a topic-specific TA support session. So last week we had a session on budgeting. Tomorrow we have a session all about brick and mortar and working with grocery stores. So these are 1 hour question and answer focused webinars that you can join and learn from other grantees, learn from our technical assistance partners about specific topics. And what will happen after either your and it's important to note that the consultation needs to be for 1 hour. You can do 2 shorter 30-minute sessions if you'd like, but it does need to cumulatively be an hour of content focused specifically on your application. So what will happen after you attend a webinar, and this webinar you're in today does not count towards this. After you attend a one-on-one consultation with us or one of the webinars, we will send you a link that will take you to a web page that has the information that we need to generate that letter of verification that Mallory was mentioning. And it's very important that when you receive this link after you've completed your consultation, that you, as soon as possible, fill in the information so that we can generate your letter. This letter is something that you are required to attach to your application. It is a requirement in the RFA, and this link is the one way that you can ask us for your letter of verification. We won't create one just because we saw that you were registered for an RFA. You, as a grant applicant, need to request this letter of verification. So if you do engage with us and you receive that link, this is just a reiteration that it's very important for you to fill out that link and the information so we can give you a letter of verification that you then must include with your application. And if you have any other questions about that process, please email us and we can explain it a little bit more. So next slide, please. Great, and these links will be useful to you when you get these slide decks. The next few slides are more resources on, more links to resources that we provide as the Technical Assistance and Innovation Center. One thing that I forgot to mention is we have many, many resources, not only related to this RFA, but to other topics about program administration that you can access for free at any time on our website. So this is a website with application resources. Next, please. If you're interested, we have communities of practice that are practitioner-led monthly meetings, usually where people just get together and talk about topics of interest for many different areas of incentive programs, including there's a community of practice on produce prescription projects. Next slide. And this will be useful to you again when you receive this. Here's just a list of other ways to engage with us and learn more about all the many, many, many activities that are happening at the Nutrition Incentive Hub. And next slide, please. Great. And I'm going to post the links and our email in the chat box. But if you have any questions about the work that we do at the Technical Assistance and Innovation Center, please let me know. All right, Dina, your turn. Thanks, everybody.
Thanks, Rachel. Hi, everyone. Again, my name is Dina Nugent. And like I said before, I'm representing the reporting and evaluation side to the Nutrition Incentive Hub, which is, we kind of look at as the counterpart to TA. We do sometimes provide a little TA, but it's very evaluation focused. To start, what I'll tell you with reporting and evaluation, our main goal is to develop systems and collaborations to support you, the grantee, in meeting your R&E requirements, while also building sustainability and capacity. I wanted to mention that just because the evaluation requirements can be substantial, but we are here for you once awarded. We're here every step of the way and also before in your application. And we will assign you a program advisor to walk you through the requirements during the grant life cycle. So the program advisor will be your main point of contact. You will also get a survey and survey advisor for your participant survey, and a firm level reporting advisor, which will help you navigate both that individual survey requirement and also the firm level requirement. together we'll go through onboarding and all of the processes. Some of the specific things we offer are listed here, and there are many more. So if you need assistance with something, just let us know. Specific services include IRB or Institutional Review Board application guidance, tailoring of surveys to include additional topics of interest, sampling plans, and also a unique thing to GusNIP is we do provide individualized annual impact reports every year, so you can showcase your impact, your program's impact with partners or funded or funders. So it's a nice service. It's very visual with statistics and numbers, and you can just pull there and use them. I'm also, okay, thanks, Rachel. You're putting some things in the chat. I may have repeated the first one she added, but there's also a little more about reporting and evaluation on the second one. Next slide, please. Just for your application, I think you've probably heard this 10 times this presentation, so I'm just going to show it to you. Those are the 2 application requirements. So for the most part, when I'm talking about R&E requirements, everything is after that. So for the application, just focus on those 2 things. Once awarded, I'm reading the slide as I'm talking. So once awarded, these are the requirements here, and they're shown on page 11. In some, it's essentially what Mallory had said, that PPRs are required to cooperate with us, with the Evaluation Center, which generally means collecting and reporting these core firm and participant level survey data. But it also might mean meeting with us to review project plans or specific protocols, or providing documentation upon request. Last, the grantees are required to have a data use agreement or MOU with each firm that states they will provide the data for the core requirements. So these would be for PPR, this would be your healthcare partners, and also the redemption site. So this would either or be a farm direct, like farmers markets, CSAs, or brick and mortar stores like grocery stores, wherever you're working. The second, back one more, I think. Wait. Yes, next slide. Sorry, you were right. The next one that Mallory hit on a little bit was the process evaluation. So this is really the tracking of milestones along the way, or more simple metrics like frequency counts, like checklists. So process and self-assessment can take many forms, but broadly the difference is that it looks at project implementation versus the impact evaluation. So you need both. But these are more the inputs and activities portion of that logic model versus an impact evaluation, which would be more the outcomes. The R&E team, if this is new to you, process evaluation, the R&E team can absolutely help you and assist you in identifying meaningful constructs of interest. So for example, if you were implementing a education component and you wanted to know that was there fidelity or was it implemented as planned, we have resources on that. Same with how many people are you reaching, how do you find that out? So we can help you with those kinds of things. And then the outcome assessment, which we hit on, there are 3 main components of this, 3 main aims. The first is, as you probably know, is improving health through increased consumption of fruits and vegetables. B, or the second one, is reducing food insecurity. And the third is reducing healthcare use and associated costs. By saying reducing healthcare use and associated costs, we also do allow increased in utilization, especially when it's a prevention program, so like well visits or something like that. So the reduction is just with depending on the context, it could be a reduction or an increase. So just know that's okay. And then the minimum requirement is right there. It's firm level reporting as well as participant level survey. That will be the core data requirement for the NTAE. And then last is the institutional review board requirement. And you absolutely do not have to have the IRB awarded by the application. A lot of times grantees don't apply for it right away because they're building their program. So in order to, you just kind of have to weigh whether doing an amendment is better than applying once you get it. But we also have a lot of guidance on IRBs also. So if you haven't ever done an application before, we have templates online. We're going to get to that. So I'm going to skip it for now. Next slide. So because the evaluation requirement is substantial, I just want to give you a little rationale of how we got here. So demonstrating the aggregate impact of produce prescription projects obviously contributes to evidence of supporting these programs nationally, especially policy implications for sustained funding and scaling up of these programs. But we needed, when we started this in 2019, everyone was evaluating it differently. So we had to introduce common core metrics so that we could aggregate it and determine the overall GusNIP or the overall impact of the GusNIP PPR program as a whole. It also enables comparisons in order to dissect programmatic features that work best under which conditions. And that's one of our roles as the NTAE. Our responsibility is to find these things out. So that's where the core metrics came from. There is a ton of rationale online, and I'll put it in the chat in a little bit of how we got there. It was a really long process that involved what grantees had done, meeting with subject matter experts, survey modules that are widely used, that are validated, but also grantee capacity, because obviously we can't require that everyone does 24-hour recalls because we might not have any PPR applicants if we did that. Next slide, please. So this is the participant level survey portion of the PPR program. This is required. So it consists of 30 items. The main goal here is to measure fruit and vegetable consumption or food insecurity. So that's really, when you think back to the objectives, there's 3 objectives. The first one's fruit and vegetable intake, the other one's food security. This covers those 2. So you don't necessarily need to add more evaluation in addition to this for those 2. So I just wanted to make that clear. So as you can see, the constructs are on the left, and then there's an example item. The survey just depending on how it's administered and who it's administered to, it usually takes 15 to 30 minutes, and we require a pre and post measurement. You are allowed to define that depending on your program length, but we are asking for that baseline, of course, and that post measurement, usually 6 months out, but it could be adjusted depending. Next slide, please. So the sample size. So the number of surveys that are required from each grantee is, and this is our fruit and vegetable intake is our primary objective. So for those that are familiar with sample sizes, that we use fruit and vegetable intake for this calculation. And it's based on the ability to detect a 1/4 cup difference in fruit and vegetable intake from pre to post. So for what this means for PPR grantees is that collecting 100 to 130 surveys from a subsample of participants at 2 time points before they start the survey and then upon completion or sometime after, known as a pre-post measurement. The sample is 100, but because of attrition, loss to follow-up or loss of participants in the program is highly likely. So it would be great if you shoot for at least 130. I think every program will be a little different, and grantees and their partnering clinics will know their patient profile to kind of know where to estimate what that attrition will be. But just know that you'll probably have to shoot for more than 100. And then the last thing I just want to make sure I'm not leaving other important things out is that some programs are targeting smaller sample sizes, and that's okay. Just let's work together with that. If you're like a new program and you're thinking about only enrolling 50 people, just contact us and we'll work it out, because we want all shapes and sizes of programs to be eligible and able to get a PPR. Next slide, please. These are your firm level core metrics. So this is that second core, participant and firm level. So what firm level means, it's really, firm just means at the organizational level. So data that's going to come from the farmer's market or the grocery store or the health clinic. It's reporting at that level. So these are the requirements there. We have, it's reported on a monthly basis or an annual basis, depending on the report. And this, of course, after it's awarded, we'll explain more about that. And it's reported through a secure web-based portal that was developed. I will put a link in the chat if you want to know more about these firm level metrics, then just go to that site right there. Okay, we can go to the next slide. And the last one applies to objective C, that healthcare use and cost objective or aim. PPR projects will collect information on some clinical markers and healthcare use and cost. We will work with you to understand the data extraction and sharing procedures for each of these. We know it varies depending on the EHR, depending on your clinic, depending on a whole host of factors. So this is something we are working on. You won't be left alone in this, but know that in your proposal, the healthcare outcomes of interest that you might want to collect usually will depend on your own individual outcomes or eligibility. So if for example, if you are enrolling only people at risk for or diagnosed with type 2 diabetes, that's going to help you shape what you want to collect, because you're not going to collect all of these. You're probably going to focus on a few that you think are going to change in that population due to the PPR program. Also, that this isn't a comprehensive list of all things you need to collect. You do not. It's just what this is a selection of healthcare outcomes that a lot of grantees choose, and also what we're interested in. And I just put another link in there on a resource on the website that goes more into this. Next slide, please. And then last, or not last, budget's last, there is an IRB requirement. That's the final component of the required evaluation. This normally will happen once awarded, and you work with us to either locate an IRB if you don't have one, or help with the IRB application itself and many other things. This is required now because we're collecting data from human subjects and clinical markers through the EHR, which usually triggers that requirement, sometimes privacy protections for human subjects, et cetera. So whereas nutrition incentive projects are often exempt, usually PPR is not, but it doesn't necessarily have to go through a full IRB. It might be expedited. And we have a world of resources on IRB, and I'll put them in here. For anyone that's a grant writer, or I assume many of you are because you're on this webinar, but just know that we have a million templates here. So before you go and create your own IRB application, look at that link, because we have things that you can basically just cut and paste. And last slide, please. Then for the budget, we recommend that you add a line item for reporting and evaluation, which might be IRB costs, an external evaluator, data collection cost, participant stipends that's what we call them, stipends that are compensation for someone's time in taking a survey. All of those things should be in your budget, and we suggest at minimum 10%. PPR is a little more evaluation heavy than NI, so it might be more. And also what I would recommend is working with your clinic or healthcare provider partner in the application process, because the data extraction piece of it, if you're going to, regardless of whether you're a grantee that's a healthcare organization or you're partnering one, there's added cost to that just because of the time burden that's required. So if you are not, if you're the primary applicant, but you're not a healthcare organization, you should definitely talk to your healthcare organization about these things in your application. Next slide, please. And then just in closing, feel free to reach out to either one of us. So the emails are there. They'll go directly to us. We check them multiple times a day. Anything TA related, implementation, development, that's TA is the appropriate email, and anything regarding evaluation requirements, email us at evaluation. And I will put in, I know I've given you a million links, but I will put in a more in-depth presentation on RNA, because I know this is really fast, but the requirements are there if you want to take a look at that. And we're all set for questions, I think.
Righty. Thank you all so much, and my apologies for losing connection there for a quick second. Thank you guys so much for continuing this going on. We are now at the opportunity in the moment for a question and answer period, and we will be getting our questions going here in a second. I'll be checking through here to make sure we didn't miss any in the chat box. But if you have any specific questions that you have not asked in the chat box, if you'd like to come off mute at this time, we definitely want to open up the floor for you. Or if you could just go ahead and raise your hand, we'll come back around to you in a moment. And I want to go ahead and get with our first question from the chat box. And the first question is this a reimbursement grant or a spend as you go grant?
I can take that one, Dr. Cannings, that's okay. So uniform guidance allows for advanced drawdowns of funds if needed, if you have the financial management and internal control processes in place. And so there is an opportunity to have cash on hand for short periods of time if that's what your organization needs. Else reimbursement method also applies very easily through our system called ASAP, which is the accounting system you'd have access to as an awardee.
Thank you so much, Beth. The next question that we have is, are WIC participants eligible participants?
I'll go ahead and respond to this question. So not through WIC itself, but that doesn't mean that they may not be eligible through a different path, right? So there's for any individual who is at risk of a diet-related disease, right, or managing a chronic health condition, who is eligible for SNAP, right? Because in some localities, eligibility for SNAP and WIC, right, is the same, or right, who is enrolled in Medicaid or CHIP, which again could be quite similar. But those are the two specific pathways to be eligible to participate in a produce prescription project.
Thank you, Dr. Canons. The next question that we have is, are there any format requirements for the business plan?
I'll take this one. Yes. So again, this does need to be in portable document format, right? That PDF format, 1-inch margins, 1.5 spaced with that 12-point Times New Roman font. And those details are also available in the NIFA application guide. But that is the standard expectation, and great question. Thank you for that question.
Thank you, Dr. Canons. The next question that we have is, or I guess a confirmation that this is being asked is referring to the number of survey participants. Is it 100 total over 3 years or 100 per year?
That's a great question. I'm happy to inform you it's over 3 years. You do not need to do that every year. It's just a pre-post over the course of your program. So if you have 5 different cohorts, you can choose from that. And that's why we recommend working with us, because we can help you make a sampling plan so it's more robust if that's what you want.
Awesome. Thank you so much, Dina. And that covers all of our questions from the chat box that have not been answered. So at this time, we want to open the floor to anyone who might have any burning questions or anything that you'd like to receive confirmation on. If you could just let yourself be known and we'll give you the floor.
Okay, so I have all the questions, loads of questions. I am a grant writer. I work in agriculture and I know nothing. I'm laughing over here when you said work with your medical partner. Like, I'm gonna have to, because I don't, like, the last third of this, I have no idea what y'all are talking about. So I appreciate that, and bear with me as I grant writer, I'm just trying to get it together. So I just wanted to thank y'all for a great presentation. Thanks for all my neediness.
And Della, is that how you say your name, Della?
Yes, Della.
Della, I want to, it kind of brings to mind something that would be helpful for, I think, everyone. With that objective C, that's the healthcare use and cost, it really helps working with the healthcare clinic or partner if you're not the grantee itself, the healthcare provider is not the grantee itself, because a lot of times I think partners aren't understanding what the requirements are, and there is a significant, like, the time burden would be more on them. So identifying things that their organization wants to work on or their pain points really helps with buy-in. So I really highly suggest before you submit to work with them especially with that outcome there, the objective C.
Yes, I work with the Food Hub, and we've been approached by a clinic who would like to do a prescription food box for their patients. So I'm used to getting money for farmers for agriculture products and institutional procurement for schools. So this is a little bit of a shift, but institutional procurement is institutional procurement if it's in a lunch lady box or a prescription box. So I'm open, the crossover will work well.
Awesome. Thank you so much, Della. And thank you so much, Dina, for sharing information.
Hi, I'm George, and I have a question. I apologize for being upside down. I've never had that happen on a Zoom or any kind of meeting, so I'm not sure how to fix it, so I apologize. But one of the things is about results. And so with, let's say, how many less visits that they had. So do you have to get like the prior year information before the program starts so that you know how many visits they had, or do you start from scratch? Also, what happens if it's a new patient?
Mhm. Yeah, that's kind of that process measure. I'm sorry, I jumped in. Mallory, Beth, Ryan, just let me know if I'm over talking. That's kind of why it's great to brainstorm a bit with either, I mean, we're available. Most of us are scientists on the R&E side, and we know this field pretty well at this point, to brainstorm appropriate and meaningful process evaluation measures, because you're right. If you start with 0, that's your denominator. It's not going to tell you anything. An improvement doesn't tell you anything when you start from nothing, generally speaking, as far as counts go. So it varies. There is no hard definition to process evaluation measures for produce prescription programs. So it can be evaluated a different way.
Thank you.
Hi, this is Erin Martin with FreshRx Oklahoma. I've emailed you a few of you and have my one-on-one scheduled. Super excited. I just wanted to ask, does it make any difference on the fiscal agent if that's a nonprofit or a nonprofit with 501c3 status? Would you all prefer it's a 501c3, or does that have any bearing on evaluation?
So for the eligible applicant, right, can be a nonprofit or governmental agency. And if the primary applicant needs to use a fiscal agent, that can be, right, the fiscal agent that's appropriate, but it's that applicant, right, that needs to be eligible. So beyond ensuring that the applicant is eligible, NIFA has no preference.
Okay, that helps. Thank you so much.
Mm-hmm.
And I might just tag on to that answer just to acknowledge for applications that move towards award, and if there's a fiscal agent involved, that organizational management profile of looking at financials and internal controls, that would happen for both the applicant and the fiscal agent, so that NIFA can ensure, there's control of both of those entities. Just an FYI.
Okay.
Awesome. Thank you all so much. Any other questions at this time? Anyone would like to pose a question?
I have a quick question. My name is Christy. I'm with the Blue Zones Project in Tuolumne County, California. I think I saw somewhere that it was 12 letters of support that were required. Is that
would be
correct?
2.
Oh, 2. Where did I see? Oh, it was number 12. Okay, never mind. I'm losing my mind.
You're correct. It is
Okay.
field 12 in the application where you upload your letters of support.
Okay, I read that wrong. Okay, thank you.
Absolutely.
So, thank you guys so much. Josh, I see you have your hand raised. You have the floor.
Hey, how you guys doing? This was a great webinar. Just want to say thank you. We're over here trying to do the grant, and we are a new farmers market in West Willow. That's in Ypsilanti, Michigan, and we are also, beginner farmers. I contacted the Washtenaw County representative for this program, and she said that we weren't going to be able to get on with them until July. I'm trying to understand, like, what as a farmers market, what we would be doing at the end of these programs, and if we apply for the funds because we're going to be giving our produce out essentially, where do we where do we get our funds back, for the produce? So that's what we've I'm kind of confused at what she was saying, and maybe she doesn't know like how the whole program goes, or maybe she didn't know who I was when calling her, but how does the farmers market part fit into this grant as we write it? And we have the letters, I have a letter from the Department of Veteran Affairs, ready to go as we're going through it. But when we got to Trinity Health, I kind of got confused with them. So if you guys can help me out with that.
I'll start by giving sort of an overview of how it can commonly work, right? So the primary applicant, whatever organization that may be, right? And that could be, right, a food hub or a farmer's market. That's the primary applicant. That organization, right, would, if the proposal is recommended for funding and moves to award, would end up with that automatic payment, ASAP payment account. And that's where the obligated funds would be. And that's the funds that can be drawn down for any of those project expenses, as well as expenses for, partners and sub-awardees. So let's say for the produce prescription, right, that the produce prescriptions are filled at the farmer's market. As those, whatever form they end up being in, as those coupons or vouchers, right, are filled at the farmer's market, they would then, right, be invoicing, the grant for the value of those vouchers, right? And that's how, like, kind of the funding would flow from the primary applicant, whomever it is, to partners and sub-awardees. Does that help?
That helps, ma'am. Thank you.
Yeah, absolutely. You're welcome. Rachel, would you have anything to add there?
No, I'd say, Josh, if you want to, I'm also Michigan based. I'm in Detroit. If you want to email us at ta@nutritionincentivehub.org with any more specifics of what's going on, we can help you out and also have some more knowledge on what's going on in Michigan, if that's at all useful to you. So please reach out to us.
Okay, will do. Thank you.
Yeah.
Awesome. Thank you guys so much. Any other questions at this time? Anything burning to ask or that you might be wondering about?
Well, thank you all so much for joining us. I'm just going to reiterate that the session is being recorded, and that the recording will be posted on that GusNIP webinars website, which is also where the slides from this presentation are already available. And all registered attendees will receive an email once all of those resources are live. So thank you all very much. Will the links in the chat show up in the recording? Yes, the chat will be visible in the recording.
Everybody.
Thanks. Bye-bye.
Thank you all so much.